How's that look? Just waiting for the Facebook Live to come on board. How's it going, Molly?
It's getting there. All right.
It's going okay? You're confident.
Yes.
Good job, Molly. Thank you. You can close that door, Molly. Oh, you're getting a consult.
Yes. Sorry.
Just doing a double check. When in doubt, ask Tanya. Some mantra here.
This is live.
And intellectual medicine. When in doubt, ask Tanya. Thank you, gang. Hello, everybody. It's Dr. Petteruti live at Intellectual Medicine and the Drip Bar. Yes, I'm wearing my face mask. We're going to talk today about a little preview. We're not going to talk much about COVID because really it's kind of worn out. We are going to talk about sexual health and about a concept that we call CellVie, CELLVIE, or cell life, which is what we feel is foundational to our immune function, our well-being, our sexual, mental, physical health. I'll explain. It'll be quick. It'll be fun. I'm going to take this mask off. I'm the only one here in this room. At Intellectual Medicine, we are open our usual time. We are welcoming patients. We are taking safety precautions, including scanning patients or clients as they enter. We have appropriate social distancing within the facility. We have hand sterilization ubiquitously, and everybody is masked up. Now, part of our cultural commitment to one another is to lessen anxiety. Do I feel like I need to wear a mask? Well, that's not the question to ask. It is, will it do any real harm to me? And the answer is no. Will it give comfort to other people who see me at the supermarket or elsewhere? The answer is yes. So then contemplate that and consider, well, why not? Now, if you're going to wear a mask, remember, try to avoid touching it because it will become contaminated. Try to adjust it by the straps if you must, like so. Okay, and when you take it off, remember, if you stow it in your pocket or elsewhere, it's now contaminated, may no longer be so good. So we got to conserve these guys, but in a reasonable way. So I have great empathy to everybody who's trying to figure out what to do with the pandemic. It's not easy to project outward. The original projections, now this came from the Imperial College of London early in the pandemic. Their modeling predicted 2.2 million deaths in the United States. Now imagine you're a politician and you hear that. That is terrifying. So appropriately, aggressive actions were taken in the absence of information. A couple questions we have now that we have hard data. Okay, what do we do next and how do we sustain ourselves? And medically, what makes sense? Well, one thing that makes sense to me, and I'd love to see this happen, I would love to have politicians stop talking to me about the virus. They're not epidemiologists. They're not pandemic specialists. Those people exist. In fact, they're enormously well-trained. They should be at the front of the podium giving those daily briefings. Why do I say that? Not only do they have more credibility, but you and I aren't going to react negatively to them like we do to politicians. I mean, let's be honest. Whenever the president, a governor, any politician gets up to speak about anything, half of us already are negatively oriented toward whatever's going to come out of their mouth next. The nature of politics. The playbook for pandemic management, and there is one, we have one of the best infrastructures in the world for managing a pandemic. And one of the key components of that is proper communication. There is no such thing as an information vacuum. In the absence of communication, information will fill the void even if it's garbage. Why do I come to you every Wednesday at noon? To fill the information void with regard to anti-aging, complementary care, and other areas that I make it my business to study in depth. It doesn't mean I'm an epidemiologist, nor do I have the credentials that some of these colleagues have in their field. They should be at the podium. So I'm calling for the president, the governors, all the step back, let your health people step forward. We trust them more with regard to this information. The decision making, what to do with that data, is not deferred to scientists. This is a mistake when people say, well, let science decide. It can't. It's too complicated. It's not a function of how many people died. That's not the only metric. We're going to talk in a moment about cellular health, sometimes referred to by the term salutogenesis. It was coined by Aaron Antonovsky, a medical sociologist, some decades ago. It's a foundational piece of why we advocate for CellVie, cell health, and why sexual health ties into that, as we'll discuss. So here we are in the midst of a pandemic. We started with modeling. Now we have data. Data is not all good with regard to our health. So let's talk about not just epidemiology, but about health, societal health. From an article in The Economist, they're looking at educational paradigms. Stopping school has a serious impact, sometimes a permanent one. The template for this came from Belgium, where a 2-month teacher strike, when compared to the students who were not affected, a significantly higher proportion of the students interrupted for 2 months had to repeat a grade, and a significantly higher number of them never made it to college. That correlates into an economic consequence that happens years later, if not a decade later. We're sowing the seeds of potential future inadequate human capital development. In addition, we have evidence from the polio epidemic. Back then, they found the kids who had their education interrupted, especially at younger ages, had a durable, profound achievement deficiency that lasted a lifetime. There are key moments on our intellectual development that, if they are removed from our opportunity, if we don't have the advantage of taking full scope of them, we will suffer permanent damage. Now what's happened, not only is there permanent damage potentially happening to every student that is being disrupted, but there's also an expanding gap between the kids who need help and the kids that have advantages. How in the world does a kid with a special learning program recreate that online? The answer is they don't. So I'm bearing this through my patients, my practice, and people I know. The child with learning disabilities is getting discouraged, falling further behind. The bright and talented kids with the bright and talented parents with lots of computer access and a private room to be quiet in, guess what? The gap's widening. And it's widening more between the poor and the rich. And the poor kids are suffering more greatly than the wealthy kids. You shut down the parks, the poor kid is on a 3rd-story tenement, he can't get outside. The rich kid goes in his backyard. The discrepancy is part of the health consequence. It's not just counting bodies. There are virtual truants. I was talking to a teacher in a school system in Rhode Island who was telling me it's impossible to track the students. It's impossible to make sure they're actually logging in. We are putting a dent in our human capital that's going to reverberate for years to come, never mind the current collapse of the economy. This turns to something described by Dr. George Everly, a PhD, esteemed consultant to governments when it comes to the psychology of pandemics. And he said, and I'm quoting him, "The psychological contagion effect is always more far-reaching than the physical contagion." Children, young people, don't die from coronavirus. Now, what I just said is not actually true, absolutely. More accurately stated, it is extraordinarily rare for that to occur. In fact, we now have data. This is from John Ioannidis, a Stanford School of Medicine professor, one of the most quoted experts in the field. The death rate for people below 65 who don't have other diseases, below 65, otherwise healthy, they represent 0.7% of all the deaths that occur from coronavirus, from COVID-19. I believe this data is not fully shared with us. In part, there may be a concern that if we know we're not at personal risk, we're going to be less inclined to be compliant, and we'll be less inclined to partake of actions as a society that we should be doing, not because we're at risk, but because it's good for the greater society. That doesn't mean that lockdown is good. It does mean that wearing a mask won't hurt anybody. Fine. Turning off the economy, devastating. There's got to be strong pillars of evidence. Initial projections are concern. Present data not lining up. So that projection that the modelers had at 2.2 million deaths now is turning into data. In Sweden, they did not shut the schools. They did not close the economy. They did social distancing, masking, hand washing, public education. Advised people 65 and older to self-quarantine and shelter. Voluntary. This is how democratic societies work best. Their death rate is the same as France. It's lower than Italy, lower than England, a little bit higher than in Finland and other countries, but kind of the middle of the pack. Their infection and death rate is lower than New York, Rhode Island, and 6 other states in America. No shutdown. I'm not retrospectively saying we ought not to have shut down. It was an impossible scenario. If you're an epidemiologist and a political leader and you don't shut down and deaths occur, you don't win. On the other hand, if you do shut down and nothing happens, in part because of actions taken, you get criticized because after all, nothing happened. It's a no-win situation. But let's get into the data, because now we have to decide how quickly do we come back to life, economically, academically, and otherwise. And I'm advocating for a rapid transition based on data. Again, back to John Ioannidis. Current statistics project a 0.12 to 0.2% fatality rate from all infected individuals, the vast majority of which will be nursing home and elderly. Their lives are not irrelevant, but they're easier to contain. Targeted containment rather than shotgunning the society makes more sense. The poor, the obese, and the hypertensives, the communities of color are being whacked. Now we've exposed, right, the prior epidemic of obesity and poverty that is disproportionately affecting the poor, and they were a petri dish waiting to get hit by something like coronavirus. And one of the greatest risk factors for dying from this disease is obesity and hypertension. And those two things kind of go together. At Intellectual Medicine, we treat obesity, along with my colleagues who are specialized in obesity medicine like me. We know it's a medical disease that responds to medical, nutritional, behavioral treatments. We're doing it now. Why? Well, because I want everybody that engages with CellVie, with Cellular Health, to come out on the other side of this pandemic healthier than when they started. So, and call for more neutral dispensation of information medically regarding the pandemic. Politicians should be the ones making decisions. They should not be the ones communicating pandemic information. Why should politicians make a decision? That's what we pay them for. It's their job. They have to make a decision because they have to factor in all these other variables. Economic devastation is not irrelevant. It affects health. Schools being closed affects, as you just learned, future economic vitality. Many of these businesses may not come back. Now, here's another thing, and then I'm going to move on to the sexual health, as I promised. We're paying people to stay home. Why? We're giving them a bonus because they happen to be caught up in the midst of the pandemic. A friend of mine lives in Georgia, owns a chain of stores. When they opened up Georgia and he called back his employees, it was difficult to get them to come back to work. They were making more money staying at home. People will do what you pay them to do. This is a little unsettling. We're living in a foreshadowing of a socialist totalitarian state where the government decides what businesses open and close. The government decides who gets what money. The government decides where you can go, when you can go, how you can move. The government decides whether or not you're essential. The government decides what you're going to do with your social time. That is frightening, and that needs to end really fast. To strip us of our civil rights, the right to gather, the right to make a choice regarding our personal risks, that is just flat un-American. Well, the reality is freedom requires risk, and if our viral extension is affected by that, that's not necessarily the worst outcome. So here's hoping for a rapid return, a rapid reopening, paralleled with targeted support for at-risk communities, the poor, the obese, and the elderly. Speaking of elderly and speaking of salutogenesis, there's a term not many of you have heard. I hadn't heard about it until my research took me there, and I love it. So we compare salutogenesis at intellectual medicine in the drip bar to pathogenesis. Medicine, as I learned it, as it's still taught, as it's still practiced, is study of disease states by and large. You get a disease, we figure out a treatment, you get a drug, you get surgery. That's how we roll. It's reactive medicine in the face of acute disease. Well, what about health? What is the underpinning of health? What is the core constituent of it? How do we define it? At the drip bar in intellectual medicine, it's more than the absence of disease. Health is the presence of resilience, vitality, vigor, mental clarity, muscle strength, bone strength, sexual vitality, all of that for your entire life. There is nothing about chronological aging that we should inevitably expect us to compromise our vitality. Better to ask the question, what's causing the compromise? David Sinclair and his colleagues at Harvard are studying aging. They have identified mitochondria as a component of it. Cell health. Salutogenesis, looking for the presence of health, studied survivors from Nazi concentration camps, and they found 27% of them not only survived, but actually thrived, maintaining positive mental, physical, spiritual health. They attributed that in part to some of their social and philosophical orientation. We believe it may have a lot to do with their cellular integrity. It was Virchow in the 1800s who theorized, quite accurately, by the way, that the cell division, errors in cell division, are at the root of many, if not all, if not most, disease states. Cells divide all the time. We are constantly replacing our body parts. Every so many days, our entire skeleton gets a new complement of cells. Our muscles, our tendons, our organs, the environment the cell is born into dictates how healthy that cell is. And if the cell is born into a toxic environment full of toxic heavy metals, micronutrient deficiencies, think Western civilization, the American diet as we know it. Imagine everybody in Western civilization, by and large, is collectively becoming more obese, is collectively becoming more micronutrient deficient. You look left and you look right and you go, well, I'm like everybody else. I'm doing the slow fade. You know, for my age, wait, right? So now for my age gets erased and we replace it with, why do I feel this way? What's missing? Or if you're feeling great today, I'll be 61 in a few weeks. Hooray, 61. Last year, at my 60th birthday, I bench pressed 315 pounds as a manifestation of vitality, youthful preservation. I will not do that this year because my gym has been closed and I can't train like I normally did, but I promise I'll do something else and we'll post it live. Anti-aging and living healthfully and living more youthfully is not merely a function of how you look. That's a component, but it's what's happening inside CellVie, salutogenesis cell health. Good cell health correlates into good sexual vitality. So human sexuality, your ability to respond, your partner's ability to respond, is built on multiple foundations. Think of it from this perspective. Much like eating, it is one of the most central components to propagating the species. No sex, no reproduction, no life, we die off. Ergo, it is one of the most important functions for human beings. The presence of a healthy libido, the presence of a desire for sexual relationship is a sign of good mental, physical, and hormonal health. What you do with it, how you manifest that, is your prerogative. That defines you as a human. It defines your values, your morals, your principles, your orientation. But that it's there at any age, at any time, is central to life vitality. So I hear people will say, well, I've not what I was when I was 35. Things are fading off. Relationships sometimes quietly just retire from active sexuality. Why? Well, one of the cornerstone elements is hormonal deficiency. You either are going to replace your hormones at some point in your lifespan, or you're going to suffer a consequence of their absence. This is a point of departure from CellVie, drip bar, intellectual medicine, anti-aging health, a point of departure from the current prevailing standard of care in medicine. That standard of care states that you ought not to replace sex hormones because the risk is greater than the benefit. We take exception to that and have a different opinion. When your glands cease functioning and you suffer consequence, why not restore them? Properly administered, properly monitored, risk can be mitigated, benefit can be abundant. So if you're suffering from that sexual decline, and it can happen more in the face of stress, tying it into the lockdown. Sleep interruption. If you're not sleeping well, your body tends to surge hormones when you're sleeping. Growth hormone, testosterone, they are surge hormones. They're not constant. If your sleep gets interrupted, you can interrupt the pituitary gonadal axis and you can wipe out desire as your hormones deplete. Replacing those hormones can prime that pump again, depending on your age. You could be as young as in your 20s and 30s and have this occur to you. In those cases, a little priming can reignite. If you're past 50 or even 40, it starts to not be so regenerative and rather becomes part of the new base. So the first thing I look for when people are suffering hormonal, let me rephrase it, sexual libido, energy deficiencies, vaginal health issues that are interfering with relations, a sign of hormonal deficiency. Erectile difficulty, a sign of hormonal deficiency, and vascular health. Look at the hormones, fix the hormones, then analyze what comes next. You don't start treating sexual issues first with counseling and then with anxiety or antidepressant drugs without fixing the organic cellular elements at the outset. Your hormones affect cellular health, not strictly sexually, but systemically. Every cell of the body is affected by hormone. They all have hormone receptors, including the brain. The brain is super critical to our cognitive well-being and to our libido function. Hormones and sex hormones in particular, for reasons I can't comprehend fully, have gotten a bad reputation amongst mainstream medicine. Some early studies correlating hormone replacement therapy to breast cancer have since been reanalyzed, have taken a much different perspective of risk-benefit ratios. Early studies looking at testosterone replacement in men have taken a new perspective. The Andrology Society is a group of like-minded doctors and researchers that are pioneering and interpreting the literature and advocating for proper use of hormone replacement at the right time. And here's an area where we really specialize and focus in: testosterone for women. That's right. Women without testosterone suffer greatly. Mood declines, confidence declines, libido fades away, irritability increases, depression increases in many cases, fatigue can become manifest, mid-abdominal fat accumulates, muscle shrinks, bone shrinks, genitalia shrink. Some women have these horrible consequences. A transient temporary use of prescription hormones doesn't solve that. You need a tincture of testosterone, the right dose. How does it tie into the coronavirus? Not directly. The coronavirus will go away. Our need to define our own health will not. Living life at your best percent body fat, getting the hormones in you in a manner that is properly balanced, in a manner that gets you to your highest level of being, your most vital self. That is how we define life, health, not waiting for disease to occur. Heart disease, dementia, and cancer, the big three, are specters that are out there generating fear for us. Sitting idly in the face of those prospects is not your best recipe. These three entities are largely environmentally triggered. Making it from birth unto death in what we call a rectangular lifespan is the goal. And that rectangular lifespan looks something like this. Gosh, where was Steve today? He was supposed to do his podcast. Oh no, he got a chest cold last week and he died. Well, I don't want to die, ever. Probably gonna. But I don't want to do this, the infirmity walk, the shuffle, get into the hospital with pneumonia, go to a rehab center. 3 months later, I'm in with a bladder infection. Then I go back. I get weak. I have a walker. I go back. I start to forget stuff. I go into assisted living. I finally die. And people say, oh, thank God, the poor thing. You and I, those of us that embrace the philosophy of CellVie, we want to die at a ripe old age with full vitality in a manner that's described as tragic. Poor Steve died at 103 in the prime of his life. That's my hope for you. I want to continue projecting this message. We'll do this every Wednesday at noon on Facebook Live. We'll do it on YouTube. We're going to continue to promote this message. I feel it's under-promoted. We're going to talk about aspects of CellVie, things you can incorporate into your life on a regular basis that you can do at whatever level you're at. We can all practice CellVie, cellular health, vitality, depending on where we stand. Our goal is to make it more accessible to you. Through the drip bar, intravenous infusions can give micronutrients that are critical to cell function. And we believe they're going to have a significant impact on health, well-being, and vitality. We know our clients that are infusing report benefits that they're experiencing. Our research in this field continues. It needs to be expanded. If we're going to do cellular vitality, as they say, the proof of the pudding will be in the tasting. So next week, I'll share with you some of the proof in that pudding that we've been studying now for 2 years, and we're starting to get objective results back from that activity. Well, until next time, gang, on behalf of Drip Bar, I'm Dr. Steve Petteruti. Stay well, live vitally, wishing you the 120 youthful years, and do wash your hands, and do put on your face mask. Like, why not? It's not going to hurt anybody, right? It may help spread the disease. The absence of absolute proof isn't necessary to take rational choices. I'll see you all next time. Thanks. I'm going to end this stream. You guys are next.